Perfect. Alright, hello, my name is John Green, and I'm going to be performing the CVAD dressing change on my patient right here. The simulation will go ahead and begin now. Hello, Mr. Rickman, my name is John Green. I'm going to be the student nurse working with you today. Before I do anything else, can I ask you for your name and date of birth, please? Alan Rickman? Wonderful, perfect. And then your date of birth? September 2nd, 1967? Okay, great. I want to confirm before I do anything else that you are the right patient, checking your wristband. And you are who you say you are. Excellent. Okay, so the reason why I'm here today, I don't know if you remember this, but about a week ago, the doctor put a central venous access device in your chest. It's that tube that's kind of hanging out there, and my job is to help keep the area clean and free of infection. So I'm going to be removing the tape that's around that area, doing a little routine maintenance, cleaning that whole area up, and just going to, make sure that it's looking really good. Have you had one done on you before? No, this is your first time. Okay, do you have any comments, questions, concerns about it? You might feel a little discomfort, but it's nothing that's going to be agonizing. If you do feel any pain, let me know, and I can see if I can help you out with that one. Now, before I do anything, do you have any pain right now? Okay, no pain, great. And then also, do you have any allergies to anything that I should be aware of? No allergies? Okay. Some of the things that I have in my stuff right here, I'm going to be working with latex, chlorhexidine, and adhesiveness for tape. Have you ever had any reactions to this before? No reactions? Okay, great, perfect. So I'm going to go ahead and just set my stuff over here just for a brief moment. Actually, you know what? Do you mind if I put this on the bed? Is that going to be okay? Just for a brief moment, I'm just going to put it right over here, just so that way I can clean off this table over here. For hand hygiene. I'm going to go ahead and get my gloves on now. I know it's not a lot of space in here. Alright, I'm going to go ahead and begin wiping off the table over here, okay? Getting this area nice and clean. Getting the edges of the sides. Let this dry for about 2 minutes. Alright, letting the area dry for 2 minutes. I'm actually going to put the hand sanitizer back. It's now been dried for 2 minutes. I'm now going to take off my gloves. Perform hand hygiene again. I'm going to move all my belongings right over here. Okay, great. So, now before I continue on, I want to just make sure that the patient knows that while I'm explaining why we're wearing a mask. So, Alan Rickman, you're wearing a mask today just because we want to make sure you're wearing a mask so that way that there's no possible signs that germs can get to the area or anything. I'd also like to make note that I'm wearing a mask and goggles as well, protecting myself from the patient and also protecting the patient from me. So that way we can keep the area clean of any infection. Alrighty, Mr. Rickman, I'm going to go ahead and turn your head away from your dressing now. So I'm turning your head away from the actual dressing site. Perfect. Okay, so it does look like it needs to be changed. So we're going to go ahead and begin that one. I'm going to go ahead and perform hand hygiene again. Alright. Move all my supplies over here just for a brief moment. Gloves back on. Alright, I'm going to go ahead and begin by removing the tape now, okay? This might be a little uncomfortable. Oh, and before I do the tape, I want to also make sure that the dressing is clamped as of now, so that way that there's no signs or anything that could happen with the clamp being discharge coming out. So I don't tell that to the patient, but it's something that I make note of. Alright, Mr. Rickman, I'm going to begin taking the dressing off, okay? If you have any discomfort, please let me know, alright? Do my best to kind of go as quick as I can. But also I want to make sure I'm not hurting you, so please let me know, okay? Perfect. Throw that away. I'm going to remove the bio patch. Perfect. And I'm going to look at the site. Looks like there's no redness, there's no swelling, there's no irritation. And the markings as well have not been moved. So the markings were put in place to show that the device itself has not been dislodged or by anything. So we know that the dressing is ready to be cleaned. We know that the device is in a secured area. I'm going to go ahead and begin removing off my gloves. Perform hand hygiene. I'm now going to begin working in my sterile environment. I'm going to first, I'm going to remove my sterile gloves. I'm going to remove my mask. Patient does not need it, neither do I. I'm going to drop my bio patch in. Just moving the sterile field up a little bit. Okay, great. I have an extra pair of sterile gloves over here in case I break any sterile at the moment at this time. All right, Mr. Rickman, I'm going to go ahead and begin putting on some gloves, okay? Hygiene. Still doing okay? No pain yet, right? Great. I'm going to remove this paper. I'm now going to prepare my tegaderm. Now, I'm going to place the tegaderm back in the sterile kit. I'm actually going to move my bio patch. Drop it in. Place my bio patch just on top, rearranging. Now I'm going to grab the chlorhexidine. I'm now going to begin cleaning the site. Click! All right. Drop the chlorhexidine. I'm now going to get my bio patch. I'm now going to get my tegaderm. Just going to place this down for a brief moment. So this hand is no longer sterile. This is a little unsecure. I'm going to put some tape down to make sure that area stays nice and tight so that it won't have any signs of moving around. Tape on there. Great. So now it's secure. All right, I'm going to go ahead and put the date on the tegaderm now. All right, I'm going to go ahead and place this on the patient. All right, Mr. Rickman, how was that? That wasn't too bad, right? All right, I'm going to go ahead and take my gloves off now. Go ahead and hand hygiene. All right, I'm going to have you turn your head back towards me now, okay? I'll help you out with that part. All right, excellent. So, I'm going to go ahead and start cleaning up my mess in here. I've kind of made a little bit of it, but shouldn't be too much. But before I take off, do you have anything that you want me to take care of for you? Get you some water? Okay, of course, yeah. So before I leave, I'm going to document in the computer the site of the area if there was redness, irritation, or swelling. There was none, so we're good to go on that one. I'm also going to make note that the device itself was not dislodged, indicated by the markings. So I'm going to go ahead and get out of your hair, Mr. Rickman. I'm going to grab all my supplies. All right. I'll be back in a couple hours to check on your vitals, okay? Take care. Oh, and before I forget, make sure your bed's in the lowest position. Look good on that one. And then also, here's the call bell and reach as well for you. All right, take care, Mr. Rickman. All right.